All right, Dr. Emer, we are live.
Hey you guys, come on in. I want to show you what we're doing today. I was actually one of the first doctors in 2007, maybe 6, doing Radiesse to the hands for filling. You can see we're doing right now. I'm putting these little blebs in here first because this will help give a little more numbing. And what we did was, in the old days, was we did one larger bleb. We called it the matzo ball technique because I was trained in New York. And then we would kind of smash the filler around. What I'm doing today is a little bit different. This is kind of little blebs. And what we do is we grab the skin and we try and go above the veins because we want to camouflage the veins and the tendons. Now maybe mix that with the other one. No, with the other one, not that one. With the one that you gave me. Go ahead and give me this. Flex your hand, perfect. And then what we do is we kind of smash it around. It always looks a little strange the first time, the first day or two, and then it all evens out. And the good thing about Radiesse is it builds a long-term collagen, especially in someone super thin, which is the people that typically need this. It will be more permanent, basically. Yeah, so that will give me, no, that was the other half of the one that you gave me. Okay, go ahead and relax. Perfect. And then we're going to continue. How is the pain level?
Good.
Not too bad, right? Okay, good. She's doing great. So again, we just keep sort of filling, and you can't do the fingers, but you can get really close to the knuckles. I just want, because a lot of people ask that. And there's actually mixed numbing in here, so it's actually not the full volume. There's a little less volume, but the reason we do it this way is it makes it spread out more evenly, and then the collagen production is a little more even. I always try and just grab the little areas that we can pinch. Perfect. So now I'll go to the other side. So you can get rid of this. Go ahead and again, flex your hand for me. And again, we just slowly smash. Now I always tell people you don't want to smash too much because then it gives them more swelling. So we just let it sit a minute. Perfect. Now relax and we're going to go to the other side. I want to show you at least right now. Again, like I told you, it's going to look kind of a little lumpy, and then it all kind of blends in. But look at the difference already with one syringe. You could see we're starting to camouflage. We're going to fill in some of these little spots. We're going to let it settle a minute, and then it will improve it. Ooh, good. Okay, so now...
Huge difference.
Yeah, I mean, it looks a little, like I say, with Radiesse especially, go ahead and relax. The filler tends to swell a little bit more, and you get these little kind of bumps. So we don't do more than too much of a little bleb at a time.
Someone's asking what procedure is this. Guys, we are doing filler to the hands right now. We're going to add volume where there's volume lost. This happens a lot in our thinner patients, and Dr. Emer was one of the first ones to do this back in 2006.
I know. We used to do fat grafting, and I never found that it really stayed that well. And then we were trying to find some filler that would give you a little bit more longevity. In came to the market Radiesse. We were using Juvederm. Juvederm tends to swell a little bit, so it looked more like a mitten hand, which is what we called it. Go ahead and flex for me. And so Radiesse tend to still be. Now Restylane Lift is one of the other products approved in the US for this. I still try and true go to Radiesse for this because you get a long-term improvement. Go ahead and relax your hand. Although I have done for people who want something that's either reversible or they're nervous, we have still done things like Juvederm or Restylane.
Someone's asking, is it diluted 1-to-1?
I cannot give you my medical dilution.
You must be a doctor.
That's my trick, doctors, okay? I can't tell you how I do it.
You can watch us do this.
I will tell you, sometimes I actually mix other fillers in here, like Bellatero, for example, which is a fine hyaluronic filler, because I like to get a little bit of the fine line improvement. And so... But just FYI, I can't give you my trick. Go ahead and squeeze again.
How long is this going to last her?
This is going to last 1.5, 2 years. But what I always tell people, especially those that are very fit, is in a year, you're probably going to want a little more. And usually I try and do a little less the first treatment, and then in a month or two, see how it looks and decide if we need a little touch up. And if we do from there, it's like a year or two. Okay, so you can relax that hand. We'll go back to the other now. So now we're gonna do half and half. So you gotta give me half and half. Make sure it's equally half and half. So now we fill in the blank. That's what I call it. And we always look where, so look here, when I grab this, not nearly as much pull when I grab here. So we need a little more here, we need a little more here, a little more here. You just kind of fine tune it. Perfect. And
Do we
again,
have vein treatment?
yes, but I'm not gonna do vein removal on her hands. I actually did that in my fellowship. So now we do little smaller bits. 2 areas where I feel we can kind of fill in. And sometimes I go a little closer to the wrist, just get a little improvement there. And this is all I can feel exactly where it's gonna be. It's doing really good. Perfect, perfect. Great. Okay, hold that, Gene, switch it up. Here's this. Go ahead and flex again. And again, this is the normal look. So again, we're pressing to kind of cover. But you can see now, look, every vein and tendon is pretty much covered. There's small areas like this triangle here and here. These 2 areas you want to be a little careful about. You don't want to put too much there initially because it could look again like you lose definition. Go ahead and relax. Now almost all the veins and tendons are covered. Perfect. So now we go over here. And sometimes you need a little less, so we're going to do a little less here. You shouldn't have much pain at all now. Are you doing okay? Good.
I don't feel anything.
Perfect. She doesn't feel anything, which is great. Try not to do too much by the knuckle. I don't want to leave her a bump. And then the key with her, just be red light, warm compresses. I don't restrict people from exercise after they do this. I'll do a little bit more over here. Good. All right, go ahead and flex this side again. I'll go to the other side. Perfect.
So I can do cardio, but just don't like put my hands around a bar to lift or something.
Honestly, I would wait 1 to 2 days. You can do, I mean, some people go 72 hours is what a lot of doctors will say. Ice it tonight. Use arnica pills if you have them. And then that's it. 1 to 3 days, go back to the gym and enjoy yourself. Your hands will be swollen for 1 or 2 weeks slightly, but no one will notice it. And then you'll be fine. All right, so let's show both hands. So you guys can see the swelling is there. That will all go down. But basically every tendon and vein is camouflaged. And then in a couple months, you know, areas like through here or through here, if they don't fully fill out, because again, remember, this is gonna spread in this plane and cover everything, then we fine tune. But this is the initial starting point, because if you do more than that, it's gonna look puffy and she'll lose the definition of her hand, and then people think that looks strange. They don't know what's wrong, but they think it's strange. This is normal. So that was Radiesse for hand rejuvenation. Lasers, skincare, and peels can all be done for the skin itself, but this was to camouflage the tendons and veins in someone thin, and I think she did great. Have a good day. Yeah, it's perfect. So now I'm gonna give you a little ice pack.